Namaste Sanjay bhai, how are you doing?
Hello Anil, I'm good. How about you?
अरे वेरी नाइस, आपको आज बहुत दिनों बाद एक साथ चैट पे आके बहुत अच्छा लग रहा है। आप कहाँ बैठे हो दुबई में और हम बैठे हैं इधर। सो हमारे में टाइम जोन का बहुत बड़ा डिफरेंस है, तो सॉरी आपको रात को हम परेशान कर रहे हैं। पर आप थोड़ा अपने बारे में बताएं अपने दर्शकों को, ताकि फिर हम आपसे और आगे क्वेश्चंस पूछ सकें। आप कैसे
Sure.
दुबई कैसे पहुंच गए? आई मीन।
So Anil, I think we know each other since our school daes, and I used to remember you a person who has learned whole of the English dictionary by heart.
Oh no, that
I
is a
still
lie.
remember that Anil was known that उसको तो पूरी डिक्शनरी याद है भाई इंग्लिश की.
No.
So I used to be envious. मैंने कहा यार ये क्या बंदा है, इसको इतनी अच्छी सब याद है, सब याद किया है. And your English was superb, during the school time also.
See,
Anyhow, like we lost the contact, but again we were in contact. I'm thankful to you, thankful to God. So again we are in contact. Regarding my journey, Anil, so after finishing the school, I went to the medical school in Ajmer only. And later on, for the master's degree, again, I went in the same medical college and I finished off ear, nose, throat, and head and neck surgery from JLN Medical College. And this was in the year 1992. I finished my medical school, and 96 I finished my post graduation. After that, I moved to Delhi for my senior residency, did my senior residency there, and in 2001 I moved to Abu Dhabi. I was in Abu Dhabi in a private setup for 3 years from 2001 to 2003. Then again, whatever may be the reason, I went back to India from 2004 to 2005. And again, as the destiny had planned for me, 2005, I was again in Dubai. And now it's 2025, still I'm here.
oh,
So
great.
it's a journey like in which I have been to my place, the place where I was born. I studied. Then I was in Delhi doing senior residency. Then in Abu Dhabi, and then at present now in Dubai.
Oh,
So
perfect.
this is how things went on.
That is because we know all the rich people live in Dubai, so you had to have in Dubai. That's the reason.
It's not like that, Anil. Not everyone is rich here. It is a misconception. So people still here, the what we call the white collar people, they are there. Poor people are there. So because sometimes we do organize the camps, we do some charity work. So we do come across them, who are here, who are really poor. So
Hmm.
not everyone moving in Dubai is rich. It's not like that.
Yeah, of course. But that is so nice. So how? So do you deal with like mostly the rich guys, or who are your clients? Like anybody can come in, anybody can register with you, anybody can be a patient,
Yeah,
or how does it go?
it's like that. I am working in a private setup in a hospital in Dubai,
Okay.
NMC specialty hospital in Dubai.
Okay.
So basically, we are having all kind of nationalities. Like we do accept all the insurances here. The insurance, the health insurance is compulsory for each everyone staying in UAE, which is being provided by the employer.
Okay.
So the category of the insurance, it varies according to the work profile that you have. So for my hospital, we accept most of the insurances, and we have, I should say, most of the nationalities staying in UAE. They do visit us because the doctors also accordingly we have of most of the nationalities. Like we have Arabic speaking, Hindi, English,
Hmm.
Urdu, and like it's a mixed population of
Nice.
the patients who visit us, and a mixed doctors, the nationalities of the doctors that we have in our hospital.
Yeah, this is one good advantage that I see. Like, when you get out of the country, you get to meet so many different people, you get to live with them, share their lives, and they come to know us.
Anil, you won't believe what I feel is I haven't seen India as much as what I was in Ajmer. I'm sure I wouldn't have seen that much of India that India I've seen from here.
Nice.
So being here, like you have people from north, from south, from west, from east of India, like all the parts of India, we do have some of the other person. And for me, I try to build up a link with the patient. It's not like that examining ear, nose, throat, and just say to goodbye to him, but just a proper conversation before you examine the patient. that makes him also comfortable, and you also feel that yes, you have achieved a frequency with the patient.
That
The
is such a
patient comes in,
nice.
immediately you say, okay, what is your complaint? You see and you send him. It's not like that. So my approach is, okay, the patient comes and sees, hi, hello, you're from which part of the world? From Pakistan, Bangladesh, India, Sri Lanka, Philippines. Then few of the places I know, like Pakistan, I very well know about Karachi, Lahore, and various cities. And me being Sindhi, so we have origin from Pakistan. So a lot
Mm-hmm.
of Pakistanis, they speak Sindhi.
Mm-hmm.
And here, someone who speaks in Sindhi, I really enjoy it. So we start conversation in Sindhi. And once we start, we enjoy it very much. People from Bangladesh, we start Bengali, thoda bahut I know. So I try to converse with them in Bengali. Then
Mm-hmm.
Urdu, touchwood, staying in UAE, I have improved my Urdu a lot. A lot of my Pakistani patients says, "Doctor साहब आप कहाँ से हैं? आप तो लगता है पाकिस्तान से." Then I tell them, no, I am from India. But conversing with you people, I have picked up this language.
Very nice, very nice. That's amazing. And this is how even the local population there, comes to know more about India, which is
Yeah,
what we would like to do in our Bharat Leads, chat. That
that's
more people know what India is all about. It's like all inclusive. We don't care who the person is, as long as we can
correct,
provide the service. That's all that
correct.
matters.
Yeah.
Very nice. So, was there something special, doctor, that you ended up with ENT and not with any other practice? Like, how did you get in there?
Basically, there are two, three reasons.
Hmm.
The first reason was my childhood. I have suffered a lot of ENT infections.
Okay.
I had to use, having issues of throat, of the nose. So this is the first reason. And then secondly, ENT, it is something which is not visible from the outside. You have to go deep into it. Nose, you have to examine. Throat, you have to go inside and have a look. Ear, you have to look into the ear. So this was another reason.
Okay.
Third reason, ENT, it is a combination of medical and surgical. Both the things are there. So my OPD practice is also very busy, and my
Mm.
surgical practice is also very busy. So it
Okay.
is combination of both. If you want to practice non-surgical ENT, you can do that. If you want to practice both medical and surgical ENT, you can do that. Thirdly, the ear, nose, and throat. The smell, the breathe, the balance, the hearing. These are the vital, the vital organs of the body, I should say, with
Hmm.
which you deal with the external environment. I do remember during COVID, a lot of patients who lost their smell. They used to come to me in distress. Sir, we have lost our smell, sir. It's very difficult what to do. We do get patients with dizziness, that is sometimes because of the ear also.
Hmm.
And they really come to me in panic mode. Husband having dizziness, wife is crying literally, oh my God, I think it is the end of the day for him. Then we have to explain to them, no, this is something which will go away. This is something very minor related to ear, and it pass off. So these are the things, because of which I went for the ENT, because you are dealing with the sense organs of the body.
Perfect. Yeah, because these are three of the five sense organs, and this is how a
Yeah.
person is in touch with the external world. So you are. Yeah, but I was just going to say, like, just like the lawyers don't take their own cases, I assume that you don't take up your own case because you had to have like so many issues in the childhood.
No, no, touch wood. Now I'm having like no more issues because now I'm more on the preventive side. So I have come out of it. But of course, yes, sometimes I need it. My colleagues are there to help me.
Nice, nice. So, since you are in Dubai, like, how do you compare your, healthcare available that is in India and that you see in Dubai or elsewhere?
Anil, in India, healthcare, it is huge volume.
Hmm.
It is huge volume. I still remember one of the senior ENT doctors in UK when he had visited Dubai. I was just talking to him. He told me that Sanjay, you won't believe few of the ENT conditions that we have read in the books. Just to see in person, I traveled to India.
Uh-huh.
So India has a huge volume of patients of different diseases. Those diseases which West it's only in the books now. So because of huge volume, we are exposed to a lot of patients. We learn a lot, we
Mm-hmm.
practice a lot.
Mm-hmm.
The only thing is that we don't, what you call, we don't make a, what you call, we don't keep a record of the things basically because of the huge volume.
Okay.
So, and as compared to West, they have, the volume is not very big, so they keep a record of all the things. So the research, the profiles, the workups, they have more planned way of doing the things. In
Okay.
India, work is being done, huge volume of work is being done. Doctors are very, very well, they're doing surgeries in which we have just read in the books. So
Right.
they've gone to base of skull, they are doing all sinus surgeries. And in India, like they can take the chances also.
Mm-hmm. Right.
It's not like that, yeah. Like once you explain to the patient, patient's also ready. And still, the patient in India, the doctor is like a dummy god.
Right.
Still the patients in
Right.
India, they think, yeah, the doctor is ultimate. And they will, if you explain to them properly, they're okay with the kind of procedure you want to do, explaining them the consequences, that it may give you relief, it may not give you relief, it
Mm-hmm.
can lead to complications. But compared to what in the West or even in Dubai, regarding the complications, you have to be very careful.
So, would you
So this
attribute
is one
that to
thing
more
where
like the education level, or is it just something
I
else?
think, yeah, because of the education level. So because in India, doctors are doing too much daring surgeries. So of course they are very expert into it. They keep on doing the things regularly. So they are very expert into doing the things.
Mm-hmm.
Then in India, the availability of the services. India churns out huge number of doctors every year.
Mm-hmm.
So services are available anytime and everywhere. Not
Right.
everywhere, I should say, mainly in the urban areas. Of course, they're focused in the urban areas. But if you see, even in UAE, to take a specialist appointment, you may have to wait for 1 or 2 days. In West, you know the situation.
Right.
But in India, specialists, they are available.
Yeah,
You
even
don't
in the
have to wait
West,
for days.
specialists are hard to get. I mean, you will
Yeah,
have to wait for a week or 2 weeks. I mean, if there
correct.
is something very important, you rush to the emergency. Otherwise, you will have to
Yes.
wait.
So a lot of people are now into the medical tourism.
Mm.
The cost and the availability of the services in India is much, much better, I should say.
Nice, nice. So, even the digitization that has happened in India, does it seem to be a little better than other places?
I think it is just beginning of digitalization in India. It has started in the major cities, but
Hmm.
still to percolate lower down, it may take some more time.
Oh, okay, okay.
What I feel is in India, even the senior most surgeons, who have been practicing and who are superb in their field,
Hmm.
uh, still they are into the practice till the age, till the time they can practice, they'll keep on practicing 70, 75, 80. I think this talent should be used more into making the syllabus, the curriculum for the doctors, which I feel is quite outdated and needs to be revamped in India.
Uh-huh.
The medical, the MBBS course or the post graduation,
Hmm.
still it needs a lot of changes to be done as compared to what is being taught in West.
Okay.
So these senior people at an age, I think they should be made more into planning of the things than practicing.
Okay, so that is nice. So, Doctor, what about, since we were just chatting with your daughter also just now, and that reminded me of the youngsters. Like all these days, they're all with their headphones all the time, even till they go to their bed. They have the headphones on. Do you see any concerns? Because this is
Yeah, of
something like
course,
that you cannot live
of
without.
course. Yeah. See, the inner ear is responsible for balance and hearing both.
Hmm.
And the inner ear has some cells which helps to convert the sound energy into the electrical impulses which are sent to the brain. And then the brain makes out that what is being spoken.
Right.
So these cells, these are the cells in the body which once if they destroyed, they cannot regrow.
Oh.
Okay. So we do have some, like most of the other cells in the body, body has a tendency to regrow the cells.
Mm-hmm.
But these cells, we call them as the hair cells.
Okay.
They won't regrow.
Really?
So once if they are affected, then that means your hearing is gone. And
Hmm.
if you're exposed continuously to the loud sounds, I think there can be a transient shift or there can be a permanent shift. Transient shift means sometimes if you go to some music program or some live music program is there and you're exposed to the loud noises, maybe coming back you may have issues in hearing, you may have some ringing sensation, but this can be for the time being, then we call it as a transient shift. Maybe in a day or two you're no more exposed to the loud noises, the hearing comes back. But in case of permanent shift, in which you are exposed to loud noises regularly for longer duration, you can have a situation in which you lose the hearing. So in
Okay.
this situation, I think you should follow the rule of 60. That is, the volume should not be more than 60 of the normal volume,
Mm-hmm.
and you should not be exposed to more than, I should say, you should go more for the noise reduction kind of headphones or earplugs. So that will lower the exposure of your inner ear cells to the damage, which can be caused by the loud noise.
Okay, so is it just the sound that is a problem? Or for example, like if you're wearing the noise cancellation headset, there is a continuous, wavelength that is going, which is like negating the incoming sound. So there is electromagnetic interference there. Does that also affect in any ways?
Till now, the studies which are still going on, it doesn't affect the electromagnetic waves. There's not much of the effect.
Okay,
The only effect of the ear cells is the hair cells is they are destroyed once they're exposed to very loud noises.
right. I mean,
Sometimes we do. I had a patient recently. He had gone to a concert, and then when he came back, he said, "Sir, whatever I'm hearing, the noise is cracking. I feel it's cracking sound."
okay.
So then again, I told him, and he was working in a call center regularly using the headphones. So already he was exposed to the loud noise, and that particular day he was exposed to more of the loud noise. That led to the problem for him. But
Okay,
once I told him to restrict the use, he was fine. Like within few days, he was normal. But in
okay,
situation in which regularly you're using the headphones, regularly you're using the high volume, it can cause issues.
okay,
And when it will cause issues, it differs from person to person. For a person, it may cause issue within 6 months. For a person, it may not cause even for 1 year. But yes, of course, you are prone to issues of hearing loss.
okay. So, do most of these issues that come up, do they require surgery, or can most of them be like cured by just medical treatment, medicines?
Medical treatment, as I told you, the person who had the issues of cracking of sound,
Hmm.
he was started on some oral. We have a medication by the name of oral steroids.
Okay.
So, according to the studies which have been done, once these inner hair cells are exposed to loud noise,
Hmm.
so there is some swelling, some edema there. So, just to reduce them, we do start patients with oral steroids.
Okay.
And if not responding to oral steroids, sometimes we have to give injections also.
Okay.
So, the loud noises, of course, it can recover, but we are not sure.
Got
And
that.
sometimes patients they do have some viral infections also, and these patients also suddenly they have issues with the hearing.
Mm.
And again, the thing remains the same, that the inner ear is affected by the viral infection, and suddenly the hearing goes down.
Mm.
This is a situation, it is like acute emergency, like cardiac emergency.
Okay.
Immediately you have to act, you have to start them on oral steroids so as to hearing to come back.
Oh, okay.
But in situation in which you have been exposed for long period, loud noises, sometimes even the medication doesn't work, then you have to go for the hearing aids.
Okay. So is it possible for somebody, or like, people in the old age, they lose their hearing? So that is a natural degeneration, right? That's not because of any noise.
No, no, that is we call it as a presbyocusis. So it is just aging of the body. As the aging affects all other parts of the body, all other systems of the body, it also affects the hearing and balance system of the body.
And is there a way
So
for them to regain that?
there's no way. Only way is to use the hearing aids.
Okay. Okay.
And of course, in the old age, because of this issue, you have issues of dizziness also.
Hmm.
As I told you, the inner ear is responsible for hearing and balance both.
That is right.
So sometimes the two issues they go hand to hand together.
Okay.
The hearing loss, the dizziness, and sometimes they have ringing sounds in the ear, what we call as tinnitus.
Okay. Got it.
So
Yeah.
these are all related to the aging process,
Mm-hmm.
which is because of the effect of the age on the inner ear cells.
Okay. Okay. You know, doctor, I'm not going to get old. I will always remain 18 plus, so no worries.
Good, good, good. I hope so, Anil. I should be also in your category then.
We will always stay young, that is for sure. So you have been
Yes.
dealing with a lot of surgeries. Is there anything that you do, a surgery that you do most often? And is there like any new developments or technologies that have come in that makes those surgeries better or
Sure.
more effective?
So yeah, Anil, these days with the pollution, as you know, the pollution is too much now around, and it
Mm-hmm.
has increased to a lot of issues of the allergies.
Mm-hmm.
So the allergies, as I told you, the ear, nose, throat, these are the part of the bodies which are exposed to the exterior, and so they are most commonly affected by the allergens.
Right.
The air that you breathe in, if they have allergens, it affects your nose, your sinuses. Sometimes, if you're a mouth breather, it can also affect your throat.
Mm.
And ear, nose, throat, they are connected to each other. So
Okay.
anything in the nose and the sinuses can affect your ear also, because there is a tube, we call it as a eustachian tube that connects nose to the ear.
Okay.
So sometimes the nose, it affects the ear also.
Mm.
So the most common surgery which I do here, mainly in the pediatric age group, is tonsils and adenoids.
Okay.
So tonsils are the gland in the oral cavity which has been given by God to for the immunity of the body. Like it helps in fighting the external infections,
Mm-hmm.
but that up till the age of like 2 to 3 years old.
Okay.
After that, the tonsils they should regress. But in situations in which the tonsils are regularly being exposed to the allergens, they do give rise to recurrent throat infections.
Okay.
So we do have pediatric cases, I should say, in the age of 6 to 8 years. The parents they come that the child is having recurrent throat infections, they're not eating properly,
Mm-hmm.
and because of a large size of tonsils, the breathing also gets affected. It
Okay.
gives rise to issues in breathing. They cannot sleep in the night. Of course, if the child is not sleeping, parents also restless. And associated with this, there's another situation we call it as adenoid. These are again tissues at the back of the nose, which again helps us in the immunity of the body.
Okay.
But once the tonsils start getting infected, they do affect adenoids also, or vice versa is also true.
Mm.
So
Yes, see,
these days
I
we
did
do
not know
surgery.
that tonsils helped immunity. I was not even knowing that.
No, they do help you in immunity. So
Nice.
these two once involved, sometimes they affect the ear also.
Mm.
So sometimes we do get parents, complaining. We are calling the child, he is not responding. Sometimes of the school, the complaint goes that we are calling to the child and he is not responding the class. Then further evaluation, we come to know that the issues with the tonsil and the adenoids, which sometimes give rise to collection of fluid at the back of the eardrum.
Okay.
So
Okay.
for these previously surgeries used to be blind surgeries because you cannot see beyond the nose, right? Behind the
Mm-hmm.
nose you cannot see.
Mm-hmm.
So previously adenoidectomy used to be blind surgery, but with nowadays we do the adenoidectomy under direct vision because previously when it used to be blind surgery, a lot of tissue used to be left behind and the situation used to recur again.
Mm.
But now with the advent of an instrument that we call it as a cobbletter and with the help of an endoscope, we do the surgeries under direct vision.
Okay, so that would
And
make it
the
more painless,
surgeries,
too, right?
it's totally painless surgery. So
Nice.
previously, the tonsil surgery, the parents they used to be, it used to be dreadful. For week to 10 days, it used to be severe pain. Kids they won't be able to eat or swallow anything. Nowadays, with the help of copulation, Hardly the surgery takes half an hour. Of course, if the surgery is taking half an hour, so you can understand the recovery will be directly proportional. Recovery time is directly proportional to the surgery time. So
Right.
recovery is very quick. Post-operatively, hardly any pain. Within 2 to 3 days, the child is fit enough to go to the school. So
Right.
Cobbletter we use for adenotonsillectomy. It's a very effective tool, and it has really revolutionized the adenotonsil surgery.
Right. Okay. So this
Then
is
the
why
second
we do
thing,
not hear about tonsil-related issues in older ages. It's always with children, right?
mainly in the children.
Okay.
Sometimes we do see this situation in the adults in which only tonsils are inflamed or involved.
Mm.
Big tonsils can give rise to big issue in mainly in the sleep. So some of the patients they do get what you call as a sleep apnea
Right.
because the huge tonsils in the adults they block the airway passage and they cannot breathe properly. And sometimes because of difficulty in breathing, they do get up in the sleep, causing sometimes issues in heart also.
So that would be related even to snoring then, right? Is it?
Correct, correct, correct. So snoring, basically, multiple causes are there at various levels. At the nose level,
Mm.
at the throat level, or down at the level of the pharynx.
Mm.
So tonsil is one of the cause, can be one of the cause of snoring.
Okay.
That I would like.
Okay. So if somebody is snoring a lot, then that is they should go see the doctor, right?
Correct, correct. Doctor should evaluate the level of the block, like where is the problem, whether it is nose, whether it is throat, or whether it is lower down. And if it is something to do with the nose, you can get the surgery done. If it is related to tonsils, very quickly, tonsillectomy for adults hardly takes 15-20 minutes.
Mm.
If it is related lower down, then we do have other surgical procedures for that also.
Okay. Okay. So changing the track a little bit, doctor. I've seen like today the elephant in the room is what is called AI. AI does not stand for Unreal's insanity. I'm just asking for artificial intelligence.
Yeah, it's in what you say these days everything is being linked to AI. The moment you switch on your laptop, immediately it comes. Do you want AI to give you the concise gist of the mail that you have received, or
Mm-hmm.
if you want to write
Mm-hmm.
a response to a mail, you want AI to help you. Of course. So yeah, AI, it is just beginning of the things, Anil. But what I feel is, the expertise and the experience that you gain down the year, it has its own role. I think the expertise should govern the AI and not the other way around.
That is it. That I agree with. I mean, it will be very hard to replace Sanjay Kewalramani's intelligence with artificial intelligence, right? That's not going to be possible, or very
So
difficult.
sometimes I tell to the patient, see, sometimes that they come to us that recently I had a young lady, suddenly she had issues in the ear, she was not hearing well.
Hmm.
Then I told her, this is my diagnosis, but I want to confirm it. Please go and do some tests.
Okay.
So the diagnosis was already being told to her.
Mm.
Even if I don't do the test, I was confident enough of my diagnosis. But when she went for the test, the things they fell down in place.
Ah, right,
So she was so happy. She said, "Yes, doctor, you tell me correctly."
right.
So, this is the thing should go on. AI, of course, in the sinus surgeries, evaluating the CT scans, AI can help us to tell us about the disease,
Hmm.
the just to give us a concise summary of the disease which is being shown in the CT scan. But how to manage the disease operatively, like surgically or medically, depends on our expertise.
Okay. So have you used
AI
like
is
a
not.
robotic surgery tools?
In
Since.
ENT till now, it hasn't been done. I think there is someone, I read somewhere that the neck surgeries, the thyroid surgeries, they're being done with the robo and all.
Nice.
But
Okay.
till now, the ENT surgeries, it's not, not much is being done with the robos.
Okay. Maybe also because they are like way quicker, so there is not much. I mean, it's not very complicated. Maybe that's a reason.
Really, I don't know. Okay, but for places like, of course, like in India, you see, They're planning to robo like a person sitting in Gurgaon doing surgery somewhere in south. They are planning for those things. Of
Okay.
course, in the remote areas, but then again, it is just till now. I think it is theoretical only.
Okay.
Practically, for me also, if someone tell me, okay, if I need a surgery and someone tell me, okay, robo is going to do it, I will also think twice about it.
Yeah, that is right. Because wherever the
That human
robot
touch is the
is,
human
you have
touch.
to make sure that the cleanliness, the hygiene, and everything
Yeah.
else is also there.
We do have some streams of medicine like radiology,
Hmm.
like pathology. Maybe yes, in which you don't have a direct human interaction.
Okay.
Maybe they will in these fields. Maybe AI is going to play a major role in coming days.
Okay.
But in the streams like surgery, medicine, or ENT, really we don't know
Okay.
how things will unfold.
Okay. So do you see like any challenges for the new aspiring doctors? What they will have to face with the advent of AI or new technologies, or does it make their life easier?
I think AI will help them in reaching to the diagnosis maybe more quickly,
Okay.
you know, and they can have AI can help them in creating a differential diagnosis of a particular thing.
Mm.
So that part can be AI can be helpful,
Okay.
but this will be before the treatment only. The
Okay.
final treatment it has to be done by the clinician himself.
Okay. I mean, that makes sense.
Sometimes I also use this glass, the glass AI.
Mm-hmm.
You must have heard about it, right? For the doctors,
No, I've not
the
heard about
glass
it, so
AI.
that's why we called you.
So yeah, the glass AI again, it helps you in creating a differential diagnosis, and it can give you a brief, outline of the diagnosis that the investigations that you perform with particular clinical picture, so you can have an idea of it. But the final
Okay.
thing, it lies in your expertise.
Okay. Okay. So, we talked a lot about hearing and smell. Uh, I would like to see, about the voice part. Is there a way we can improve somebody's voice? Like if I want to make my voice more like a radio quality voice, what can I do?
I don't think so. Anything is possible, but
Ah,
because doing these kind of things, we are not sure. Maybe you lose your voice, whatever you're having now.
oh, really? Okay. Then I'm
So
going to stay
it's
away from
risky.
that.
So I think whatever voice has been given to us by God, you should take care of it, by taking proper precautions, like not shouting, and not. I should say, basically, what we see is the people who are into the professions like lawyers, the preachers,
Hmm.
and the teachers.
Hmm.
They have to use their voice a lot. So they do come to us a number of times, with the change in the voice, and for them, the voice is their livelihood. Like a
Right.
teacher, for a teacher, the voice is a livelihood.
Yeah,
If I
yeah, yeah.
ask teacher, okay, if you're a software engineer, I'll tell you, okay, you have to stop using your voice for 6 weeks. For software engineers, it's not an issue, but
Hmm.
for teachers, it's a big issue. So basically, I do keep on conducting courses in the schools regarding the vocal hygiene, how to take care of your voice.
Okay. So,
So basically, yeah, tell me.
no, I was just going to say, like in that regard, do you think any of our Indian ancient medicines or like Ayurveda or even yoga, is there anything that people can use to keep their ENT related issues away?
Of course, Anil, you must have heard about a Jal Neti in yoga,
Yes.
in which, there used to be a neti pot
Yes.
in the old ages, and this neti pot used to be filled with water,
Hmm.
rinsing the nostril. The water used to go from one side and it used to come out from the other side.
That's right.
And I still remember when we were in India, we were practicing there. We used to ask the patients to put a teaspoon of salt and a
Mm.
pinch of baking soda into the
Okay.
water.
Okay.
Just mix it into the water and use this water to rinse your nostril.
Mm.
So basically, this concept has been adopted by a lot of pharmaceutical companies, and you have lot of nasal rinses in the market.
Yeah, you're right.
We call them as saltwater sprays.
Mm,
The saltwater sprays, it is a very very good treatment for the recurrent nose and sinus issues,
right.
because people who are known to be allergic to the allergens, they can rinse their nostril regularly,
Hmm.
just provide like preventing the issues to aggravate further, leading to sinus infections and nose infections.
Right. Isn't this
So
interesting, doctor, that, since in olden times, people in India knew about this nose rinsing using neti parts, and the new medical science is just catching up with it?
yeah, that's really interesting. So the olden times, they didn't had those pressurized containers what we have now,
Hmm.
but and it's a huge market.
You're right.
I see every day a new company is coming out in the market with these nasal sprays.
Right. Yeah, I
So,
see even on
so
Amazon there are lots of neti pots, available these
yeah,
days.
yeah. But of course, neti pot, to carry neti pot, a bit cumbersome. So the easiest solution is these pressurized cans, which are
Okay.
easy to carry.
Okay.
So, and they have really very very good effect. Like I do, each and every of my patient is having issues of nose and sinuses, I
Hmm.
do write this nasal spray. So they help you in rinsing the nostril, rinsing the sinuses, taking care of the nasal mucosa, keeping the nasal mucosa hydrated, preventing the dryness of the nose, preventing the bleeding from the nose. Some people have issues of bleeding from the nose because of the dryness of the mucosa. So this
Okay.
dryness is also being prevented by these sprays. So they are very, very helpful.
Yeah, I was about to ask you, you reminded me at the right time, about this nose bleeding. Like people are nose bleeding, especially I've seen in winter.
Yeah, the winter climate, it is more a dry type of climate.
Hmm.
And the nose is a very, very vascular part of the body. It's having so much of blood supply.
Okay.
So the winter climate leads to dryness of the nose, leads to crusting in the nose, and especially on the septum. The septum is part of the nose which divides nose into right and left half.
Right. Hmm.
The septum, it has a confluence of blood vessels, which, if dried up, can give rise to bleeding. So
Okay.
the best solution is keep on using the nasal spray, keep on using the gels are available in the market, the salt gels, the sodium chloride gels.
Okay.
These are the remedies. Or the best thing is the ghee, the pure ghee.
Hmm.
I tell a lot of my patients just take some ghee and just put into a nostril. It it works miracle. Pure ghee.
Nice.
It lubricates your nose, it keeps it moist, and you can prevent a lot of issues of the nose using the ghee applying in the nostril.
Yeah, because over here I see like once it starts snowing, obviously it becomes really dry because
Yeah,
all the
yeah,
moisture in the air gets frozen.
yes.
Very nice. Dr. Saab, Sanjay Bhai, it was very nice talking to you. Maybe I'll pull you up with more questions some other time, but we really
Sure,
appreciate you
sure,
taking the time today.
sure,
Thank
sure.
you so
Anytime.
much.
Anytime. Thank you. Thank you. Thank you very much.
Thank you.
Okay.